This call is being recorded.
Hello?
Hi, is this Kim?
Yes.
Hi, Kim. Nick Corum here. How are you?
Good. How are you?
I'm doing all right, thank you. Hey, I never heard back from you, and I was just following up about my concerns, basically.
Yeah, so I wasn't the one that was going to call you. I'm glad you're calling me because I wouldn't be the one to reach out to you. But what we did was, I'm sure you've gotten the letters by now, that there was a complete investigation of your concerns and your HIM investigation. I know she sent the letter out. It might not have gotten to you yet, about asking for your record to be amended. Those are all things that HIM reviewed, and none of the physicians wanted to change their view of what they had documented, so that will remain. And there weren't, they did not find any fraud or anything like that. So your questions about that, you know, she has answered in her letter, and I'll let you get that letter and review it, and you would be able to ask her other questions if you wanted to about it. But those things were settled, and one of the providers that you saw is no longer here, so we can't do any investigation with her.
Which obviously is more or less concerning because that particular provider is the one who made the fake biopsy.
Yeah, she's no longer here, and we can't change what she wrote because she's the only one that can say whether or not she would change what she wrote.
Okay. So with that being said, just because, I mean, when I look at my medical records and I see how there's just like so many blaring inconsistencies, and you're saying that nobody thinks that anything's wrong with it. So I'll go ahead and download my medical records again just to make sure that everything is the exact same as before. But then I guess I have so many questions regarding them, and I don't seem to be able to get any answers. Do you think this person who is writing the letter will be able to answer my questions?
They will answer in the letter the answers that they have. I mean, they don't, if it's not in that letter, they don't have the answers that you're looking for. But they would be the medical records person would be the one that would, you know, have whatever answers that she has. Now, I'm not going to promise you that all of your questions are going to be answered because she may not have the answer, or, you know, your question may not have anything to do with something that she can work with. But she has put in the letter, she has replied to your, you know, concerns about your medical records. And that probably is pretty much all that she's going to say, but she'll give you instructions in the letter if she, you know.
Okay, so I guess if she's not able to answer my questions, is it okay if I still seek the answers through other employees at Denver Health, such as like calling the medical records office or calling?
That's who's sending you the letter. The medical records office is sending you a letter. There's no other employee that's going to talk to you. They've already been told that your case has been sent to medical records. They're sending you a letter. That's the definitive answer. It's what's in the letter. There's no other employee that you can have contact with about these issues because they don't know and they can't help you.
Okay, so I guess that kind of leaves me in the dark about a lot of the situation then, because if I can't ask anybody questions regarding it and nobody knows the answer, then what am I to do?
That's up to you. You know, I'm just telling you that we have given you answers. I've done a review. I've asked everybody that you've called. You've asked the same questions. They've given you the same answers. We've looked at it ourselves. I've looked at it. I'm not sure what it is that's bothering you about it now, but I don't find anything in your record that gives me pause. I mean, they did what you asked them to do. The only thing that I can see, that a question that you may have asked about the provider that's not here anymore is maybe, why didn't she give you certain treatments? That's a medical decision. Nobody can answer that but her. She makes a medical decision about what she's going to do.
Her. I think there's a provider that still works for Denver Health that didn't actually provide treatment.
Well, if you didn't provide treatment, what is it that you want us to tell you about it? If that doctor did not provide treatment.
Well, I think I would like to know, I guess, one, why, and then two,
why what? Why what?
Well, why didn't she provide treatment? And then two,
those are medical decisions, and she can make whatever medical decision she wants.
Okay.
And you've asked her, because I spoke with her, you've asked everybody, like, why didn't she do this, or why wasn't why weren't you given this medication? And they gave you an answer, you just didn't want to accept the answer.
They haven't actually given me an answer, though, because I've asked, even on my after visit summaries, why is it showing a different medication that she never prescribed?
And that information that's on the after visit summary may have been there, and they gave you another one that shows the correct whatever the medication was. So I don't think you're going to get much more information than that about the after visit summary.
Okay, that's fair. And then it's, I guess, as you can probably imagine, I'm again still at a loss for the information because I'm trying to figure this out myself, and I really thought that at least if I asked questions that maybe I would gain answers, but it doesn't seem like anybody actually knows the answers.
I don't know that they don't know the answer. I think you're asking them questions that really either is a medical decision, or with the ABS summary, they may have given you the wrong one at one time and given you another one, but I don't get the purpose of the question because I'm not sure what it is that you want us to do about it now. If there was a mistake made with the after visit summary, what would we do about that now?
Well, I think that's why I asked for it to be amended, because if there was a mistake, then...
Well, we don't amend after visit summaries. There's just no need for that. To amend, why would we amend an after visit summary? Why would we do that? What would be the purpose of that?
The after visit summary for me is a way of actually seeing exactly what happened on that day with them, especially because when I look at my medical records, it's a different thing. So that's why I'm trying to be, I guess, diligent in my quest to find the right information. And that's, again, where I feel like maybe your organization is falling short.
Maybe. That could be. I don't know. What I will tell you is that you'll get a letter from HIM, which is medical records, that addresses a lot of those things, and maybe that will help you to, have some answers. But in my review, I'm just really not sure what it is that I can do for you, even if you got a different after visit summary. I just am not sure what could be the remedy. If someone made a mistake, they made a mistake. I'm not really sure what else we could do about that.
And I can respect people making mistakes because I'm also a human. I make mistakes. I made plenty. But at least when I do make mistakes, then I own up to them and I say, hey, I made this mistake. I'm sorry if it affected you. So potentially that might help, just be like, hey,
I think that they have said that they're sorry this happened. I don't see the mistake myself, but I'm saying if there was a mistake with your after visit summary, I would apologize. I apologize for that. I see one that says doxycycline and clindamycin, and there may be another one that has a different medication on it because they decided to change it.
And then after changing it, though, wouldn't that be something that I should have been informed about?
Yeah, it says in your medical record, it talks about you being told about it. That's the issue.
I haven't seen that where they say I was told about this at all anywhere.
And so if you weren't told about it, what would we do about that now? Because when I'm looking at it, I see that you had an after visit summary, and it says take your doxy and your clindamycin, and then
And I
they
guess
have several.
if I could just ask you, maybe like more specifically, which one are you looking at?
It's from 5/4.
Okay, and did I have an appointment on 5/4? Because
You went to
that's
the
actually a
ED.
telephone. That was a telephone
It
visit.
says you were seen for rash and folliculitis on 5/4. Family medicine specialty, Dr. Colangio.
I definitely did not, though. That's the thing.
So you did not see Dr. Colangio on, it just says that that's a specialty. It didn't say you see. You were seen by Andrea Navarre, PA, for rash and folliculitis. Is that,
Yeah, and
that's
and
not
I guess
true?
so. I guess if you were to actually look back onto 5/4 of 2021.
Oh, okay. No wonder. I'm in 2022. Yeah, that's why. I'm in 2022.
Yeah.
Okay.
And I think
This
that's
is
like
Sylvia Bryce. Yeah.
Say again? And so
I
like
see this
with that
one with
one,
Sylvia Bryce and Abigail Cook.
yeah, and that was one that apparently was done over the phone.
Mhm.
But again, that doesn't really make sense onto why I would have an urgent care doctor over the phone.
Well, if you have a doctor at any point, they can be over the phone or not over the phone. So what would be suspicious about a doctor being over the phone? There's telemedicine.
Because I don't believe that visit actually happened. That's
Uh-oh.
why.
Well, I can't. That's something I can't help you with what you believe. I can just go by what's documented here. There was an e-consult. You saw dermatology on the 27th, Cheryl Armstrong, and you saw on the 27th another dermatologist. You know, they reviewed your dermatitis, your folliculitis, and then you were in the urgent care.
You said I saw another dermatologist on the 27th?
It says I have two dermatology notes, a doctor and two doctors, in fact. One's talking about that they saw you in the clinic with the other doctor. So one doctor is saying, I evaluated this person in the clinic with Dr. Shangra, and they agree with their findings. That's how that doctor.
And that was on the 27th? Because I only saw one doctor on the 27th.
You might have. There may have been another doctor that was attending that doctor and agreeing with their diagnosis.
So, but what you just said was that they examined me in the clinic. Am I mistaken in my assumption?
This says that you had a chief complaint. It doesn't say where you were examined. It just says that on the 27th, they do your family history, your past medical history, your chief complaint. I don't know exactly where this was.
So again, these are
urgent. There was one in, if it's not in the dermatology clinic, and it doesn't say clinic, I don't want to say where it was that you were seen because I don't know.
And I think, again, because like these are the really pressing concerns that I'm having that, hopefully in this letter will be addressed.
Why is that a pressing concern? What bothers you about that?
If I could ask, if you were in my situation and you felt as though that they were potentially making up fake reports and fake visits.
Well, what reason would they be making up false reports? What would be their reason?
I believe their reason was to do it because they're trying to cover for Cheryl Armstrong's negligence.
What negligence was that?
The negligent fact that she, again, more or less judged me on the fact that I did not want to get a vaccination at the time. And because I didn't get vaccinated.
That's not documented anywhere here, and I'm not going to go along with you saying that because I don't know that to be true. That's just something that you're saying. So we're not even going to go into that. If you believe, If you want to believe that, that's up to you, but that's not in the documentation. Nothing in this documentation that has anything to do with you getting or not getting a vaccine.
Do you think it's acceptable for a doctor to ask me whether or not I'm vaccinated regarding a dermatology appointment?
Yes.
They're allowed to do that?
Anytime they should be asking people in case you want to get vaccinated. So yes.
Well, when I told her that I was not interested in getting vaccinated, she continued to press me on the issue.
Well, I don't know anything about that. I'm just knowing what you're telling me, and that has nothing to do with this. And I'm not going to even go into it because I don't know if that's true or not. I have no idea. It's not documented here as such, and that's the only thing I'm going to look at. It's what's in black and white. So those are the questions that you have. I still don't know what else we could do for you, even then, even if everything that you say is true. What would we do about it?
Well,
what is it that you're expecting? What do you want?
I think an apology would be in order.
I think people have apologized to you, and I just apologized to you. So I don't know how many more apologies you would need, but I apologize.
And I appreciate your apology. Thank you. But I believe that the doctors who actually committed, in my opinion, what would be malpractice should apologize.
Well, they don't believe they committed malpractice, number one. And number two, the lady that you're talking about, one of the doctors that you're talking about is no longer here. So there's no way for me to do anything about that. But the other people don't believe they committed any malpractice, so there will be no apology from that. So what would be the next thing? What else could happen?
Can I ask again? I mean, I know that maybe you don't know, but I would like to at least ask you this question. So, for example, test results, right? And if you're getting a test, like a lab test done, and then you see in your medical record that the final result is for a particular date and time, do you agree that's pretty normal?
I'm not going to do cross-examination with you. What's your question? What do you want to know?
Well, I was just asking because it's if you really think that when you see the final result being for a particular date and time, but then you see the analysis date and time being different.
They're not going to analyze stuff particularly on the first day that it gets to them. It might be the next day. It depends on the test, what kind of test, how long they need to wait. There are lots of questions that go into it. So what's your question once again?
So again, you kind of just answered it though. You're saying that they're not going to get the final result on that first day, right?
It depends on what the test is. It may or may not come on the first day. We don't even know what test you're talking about. What test you're talking about?
What I'm asking you, I guess what I'm asking you then would be that if I look into my medical records that I just downloaded, and I see through my testing that there's for example, my final result is the exact same date and time of the collection.
Okay, so what does that have to do with anything if there's a same date and time?
I see that my analysis time was a later time than when my final results were actually recorded.
And so how are you harmed by that? What does that have to do with anything?
To me, it wouldn't seem like that's accurate information.
Well, that's fine. If you think it's not accurate information, that's fine. I don't know how to help you with that, with those questions. The questions that you wanted answered, I think HIM has answered in their letter.
Sure, and I think by them,
pretty much as far as we can go with it.
Sure, but by them denying my request, even though I think you and I can both safely agree that this isn't accurate information, but in my letter that they said denying, they're saying that this is accurate information.
And so how has that harmed you? Just tell me what it is that you need, because what you're talking about now has nothing to do with, how has it harmed you? Did you get results?
No, because I don't know if I got accurate results. I'm seeing a different time for my final results versus
I think what you need to do is, these are the answers that you're going to get from us. So I can't, first of all, I'm going to get off the phone because I have other things to do. But what I want to tell you is that what you're going to get is going to be a letter from HIM about the things that they had questions for.
Okay.
There aren't going to be any more calls to any other providers that are going to talk to you about the situation because they feel they've given you the answers and I've talked to people, and I'm looking at your record, and I've investigated, and I think whatever other questions that you have, either we can't answer them or the question doesn't make sense to what it is you're complaining about, because every time you get an answer, then you have a different question. So we're not going to keep going around and around in a circle. So what we're going to do now is I'm going to tell you that I am not going to continue to have this conversation with you. And so thank you for calling, Nick Corum, and just look forward to the record from HIM.